whether or not you should have your rotator cuff repaired is actually a very nuanced decision. It has to do with the size of the tear, the retraction, age, activity level of the patient, what's been done preoperatively. There's a lot of data and information that goes into that decision. So ultimately, the decision whether or not to have surgery is the patient's decision, right? So I think that's a big misconception is, you know, whose decision is it? What should you do? It's the patient's decision. The question they should be asking is can this get better without surgery? And the answer is yes, sometimes in some cases, right? It depends on the tear, it depends on the pattern, it depends on a lot of factors. So I think that would be a first misconception, is that either you have to have surgery or that you can get away with not having surgery. It's different for each patient. Other misconceptions I have are that, you know, surgery is going to be horrible, right? If you have surgery for rotator cuff, that's probably the biggest one, is people know they're in pain, they know they have a tear, and that they want that problem solved, but the solving of the problem is going to be brutal. And what we have found in the majority of our patients that get rotator cuff repairs is that it's not a brutal process. It's actually a very tolerable process. Patients tell us it's just not that bad. You don't have to take that much medicine. You know, we try to make that the recovery from surgery from rotator cuff repair very mild, right? So there's minimal pain after surgery, that the pain is extremely mild, that they're not taking narcotics for, you know, maybe a day or two. They can use their arm right away. And what we want to hear them say is, you know, I heard all these horror stories about rotator cuff repair, and my surgery was very smooth. I did not have a lot of pain in my shoulder after surgery. I was able to use my arm quickly. And I think that's probably the biggest misconception that I have found, or the what has been felt by many people. But what we have in our practice strive to change is that rotator cuff repair surgery doesn't have to be brutal. It doesn't have to be this horribly painful process where you're restricted for months and months. It can be a quick, relatively low pain or pain-free procedure, and you can start using your arm right away. Those would be the biggest ones.